Dear friends, dear members and participants of the international exhibition Digital Health, which is organized the third time, and we are so glad to see you in such a comfortable atmosphere. And with a great pleasure, I'd like to introduce the speaker of this session, Mr. Clayton Hamilton. Mr. Clayton Hamilton, are you with us? How are you?
Very well, thank you. Thank you very much.
Yeah.
Pleasure to be here today.
Mr. Clayton Hamilton leads the Digital Health flagship program within the World Health Organization Regional Office for Europe's Division for Country Health Policies and Systems. We are so glad to see you today. And start with the questions. How has digital health been employed in Europe during the COVID pandemic for health service delivery and in support the continuity of essential health services? Please, you are welcome. Mm-hmm.
Yes, thank you very much. So what we've seen in Europe has been a very interesting and very diverse application of digital health technologies during the COVID-19 pandemic. And as the epicenter began to move from Asia towards Europe, what we did at WHO was to perform a landscape analysis to take a look and make some sense of how digital health was being applied in different contexts. What we essentially saw from this was 6 major categories in the way in which digital health was being applied. So the first of these was really what we call awareness, prevention, and tracking. And as we all know, we saw the emergence of a very visual number of dashboards, information apps, websites, and mapping utilities very much focused on monitoring and tracking the pandemic. We also saw a lot of social media chatbots and community forums arise, and public health surveillance and forecasting tools, including digital proximity tracing utilities based on the mobile phone. The second category, which we saw, was really very much focused on diagnosis and diagnostics. Mm-hmm. So here we saw symptom assessment apps and online utilities emerge. We also saw a number of tools for remote monitoring of vital signs, including some based on a smartphone camera. And we also saw examples, for example, of artificial intelligence-powered CT imaging interpretation tools. Mm-hmm. We also saw digital health applied to managing contacts to the health system. And again, we saw very much publicized telemedicine and teleconsultation software be employed. We also saw triage chat services and care chatbots. And also for those countries which have e-prescription systems, we saw them being calibrated and streamlined to ensure that essential medicines could be prescribed and dispensed. We also saw a category which we're really calling surge capacity management. That is very much looking at how the surge in secondary care or hospital cares was being managed. We saw a number of digital surge simulation tools arise, and also systems really to manage equipment and staff and individuals involved in caring for acute COVID-19 patients. Mm-hmm. In terms of protection, testing, and research, we saw that a number of tools have arisen for self-management for those who may be in isolation and voluntary reporting tools. We also saw use of robots in this category in secondary care and technology support to accelerated testing regimes and adaptive clinical trials for COVID-19 vaccines. And then finally, we saw a smaller category, but nevertheless an important category, which we've called recovery and reestablishment. And that is really digital health being employed for certifying an individual or even augmented reality-based temperature monitoring in public spaces. Mm. So you can see from these 6 major categories, there's been a really diverse and wide application of digital health in responding to the COVID-19 pandemic. Mm-hmm. What's noteworthy about this is that many of these applications have really validated what we're saying prior to the pandemic. That is that digital health can and is playing a much greater role in delivery of primary health care and in ensuring the continuity of essential health services delivery.
Mm-hmm. And what about data? How has data been used in responding to the COVID pandemic, and what are the major barriers countries are experiencing?
Yes, well, data has certainly been the pivotal point in how public health authorities have actually responded to COVID-19. And I think while we've seen some of the major barriers for digital health actually be removed, we've also seen the importance of having timely access to vital health data to ensure an informed, consistent and measured health system response to pandemics. So what do we mean by this? Well, firstly, in terms of informing health authorities, data has been used to generate knowledge of how and where the virus is spreading, which population groups are most vulnerable, and in guiding strategies for ensuring the protection of such groups and when and where resources best need to be deployed. In terms of consistency, again, as we've seen in many countries across Europe, the inability to apply consistent approaches to responding to the pandemic has actually allowed it to propagate. So the use of data to ensure a consistent approach within countries and across borders has actually been a very important factor that's often understated. And then finally, in terms of a measured response, over time, as the transition profile of COVID-19 has changed, the responses to the pandemic need to be calibrated and focused to mitigate potential and socio-economic impacts. So we've really seen data used across those three areas. Now, of course, there's been a number of barriers in terms of data use, and many countries have quoted a lack of access to timely health data, both in terms of the epidemiological progress of COVID-19, but also on health systems capacity and performance. And here we've seen really the broad spectrum of barriers to data use that have been a big issue. So delays in receiving data, we've seen a lack of health data and metadata standards applied. We've seen the actual health information architectures really crumble under the strain in terms of trying to access timely information. And we've also seen little health data governance applied to national health information systems. And of course, there's been a bottleneck, a limit on the number of trained people that we have available to manage and use this data. So all round, it's really probably one of the big lessons we've had to learn from COVID-19 in terms of the benefit of data use and what we need to do moving into the future to ensure better data throughput and availability.
So, and how is the balance between public health needs and personal privacy being achieved in countries during the pandemic?
So this question is a little bit more difficult to answer, and it's important to point out that governments don't necessarily perceive the importance of protecting personal privacy in the same way. But those governments who've really taken it seriously have employed a number of kind of very concrete policy and legislative tools in order to protect the privacy of individuals during this pandemic. So firstly, the implementation of specific time-bound legislation that's applying to the use of digital technologies with a very clear end date. We've seen the establishment of new accountability mechanisms governing data, including service validity and data retention policy, so how long data can actually be kept for either monitoring or research. We've seen the incorporation of ethics considerations into solution design, so the digital solutions being designed, having informed consent mechanisms so that as an individual, we actually are supplying consent to the use or not of data for research, testing and monitoring. And finally, in the actual design of technology, so ensuring that they are privacy preserving to avoid the risk of governments having overreach and working to establish public trust. So this is obviously an area in which we need to be extremely cautious. If governments don't exercise transparency and accountability, we actually risk irreparable damage to the trust of populations in the use of digital technologies, and we may never be able to regain that. So very much the balancing act, so to speak, between the public use of data and personal privacy, protecting that data is a very important question, and one in which governments have, I think it's fair to say, struggled to find the appropriate balance.
Yeah, one more question for you. What have been some of the main lessons learned regarding the adoption of digital health in the context of the COVID pandemic?
Yes, a number of lessons have been learned. So, for example, in the very beginning, health authorities were overwhelmed with systems and offers from the private sector and other partners, the value of which many of these solutions was difficult to assess. So having a digital pandemic preparedness and response plan and governance of ICT solutions was really a critical lesson learned in the very beginning of the pandemic. Also, maintaining essential health services was a bigger challenge than most health authorities had actually counted on. And having systems for telemedicine and remote monitoring to support primary healthcare is one of these areas which has been particularly used. So again, responding to the actual COVID cases has been very important, But there really is a broader health system and a public health system which also needs to continue to function at the same time. As I've mentioned previously, timely access to data to support response actions and policy design was in many cases difficult or impossible to attain. So strengthening national health information systems, I think it's fair to say, is one big lesson that we've been able to take away from COVID-19. Also, ensuring appropriate linkages between the different systems is vital for consolidating and streamlining access to care. And we've actually seen some very positive results as systems used for testing have been linked to systems for public information display and also right up into decision-making systems for the government. So that high level of integration has been a real key factor. And then two other things I think worth mentioning. The health workforce was really quite poorly prepared for adjusting to work in a digital environment. So more investments are needed in developing digital competencies of the health workforce. And finally, preserving fundamental and human rights in digital environments during exceptional situations such as pandemic are really crucial. And to do that, we need appropriate oversight and accountability mechanisms governing the sharing and use of data to be established and maintained.
And what are the major inequities regarding access to digital health in Europe?
Yes, well, at its most basic, there are barriers to health information and care delivered digitally. We need to recognize that half the world still doesn't have access to the internet, and only 45% of people are connected in developing countries. And in the least developing countries in the world, that number falls to just 20%. 1 in 5 people in the UK, which is usually a good digital health bellwether, lack even basic digital skills and don't use any form of technology at all for their health. So when we think of digital inclusion, we think of it as 3 different things. We think of the digital literacy and skills of an individual. We think of the connectivity to the broader environment and the accessibility to health services. Our ability or our inability to have timely access to high quality data for health is also a key determinant of health inequity that is becoming more and more relevant as more and more data is used and more systems become data driven. And this is really applied unilaterally across public health, healthcare, and personalized health context. Most notably, vulnerable population groups are disproportionately impacted by the digital divide. So digital technologies may, in some cases, serve to increase health inequities associated to increased age, lower level of educational attainment, and lower socioeconomic status, including those with poor housing. But there are other population groups that are adversely impacted, including immigrants and refugees, disabled groups, even rural populations, and those with language barriers can be adversely impacted. Not surprisingly, these groups are also typically the biggest or heaviest users of health services. So all in all, these health equities have arisen due to fundamental inabilities to access the internet and to access care provided by digital solutions. And this is something which the international community is very aware of and is focused on mitigating.
So we also have seen a major transition to remote methods of delivering primary care during the pandemic. So what is your opinion of this transition? And do you think it will continue?
Yes, absolutely. I think this transition has begun and will continue from now until the short to mid-term future. But absolutely, the challenge will be to accelerate the digitalization, and particularly in primary care, in a sustainable way that ensures integration with other systems that may be available. There are still a number of barriers that are well known to the adoption, including social barriers, skills-based barriers, economic barriers. But there's an immense momentum which I think now has raised such a broad interest across populations and including healthcare professionals that it will be difficult to turn back to the reality that we knew prior to COVID-19. But as we've mentioned, not all social groups are equally able to access or harness the power of digital technologies. And we can't afford to have a digital divide in such circumstances on top of potentially existing social and economic divides which may exist. So I do believe that the transition to digitalization of care and digitalization of public health will continue. But again, we need to take a guarded and cautious approach to ensure that the benefits of such digitalization are spread evenly across the population.
Yeah. So, and what is the World Health Organization doing to advance the digital health domain in Europe?
Yes, well, in WHO, we're moving forward with the creation of what we're calling a digital health flagship, operating under our office's European program of work. And there are 3 strategic actions which we're putting forth to try and assist health authorities across the 53 countries of our region to strengthen digitalization of health systems and health services. The first one is a concentrated strategic action for accelerating the digitalization of health systems and public health. And to do this, we're in the process of developing a digital health roadmap, which addresses the very building blocks of digital health ecosystems and strengthening primary health care. This includes leveraging and internalizing the innovations which we've seen from the private sector that have now begun to take hold during this time of pandemic. This particular action also includes efforts for specifically strengthening the integration of primary care and public health. So again, we see a feedback loop between these 2 entities of the health system which need to be strengthened. The second area is really focused on improving the governance of data for health, and I've mentioned a number of times the importance of having timely access to health data. So what we're looking to do here is to mobilize data so that its value can be gained in different environments for different stakeholders across the health system. To do so, we're looking with international partners, both in the public and private sector, to develop an international data governance charter as an online or a common set of European guardrails for the use of health data. And in this way, what we want to do is to be able to address all of those elements that actually surround health data and its use, including consent, ownership, different forms of privacy, different forms of sharing, so that we have the development of an open data ecosystem that people can begin to trust and to use freely, irrespective of where the health data itself arises. And then finally, developing partnerships and strengthening partnerships for digital health, including for pandemic preparedness and response. We've been overwhelmed by offerings also from the private sector in terms of innovations, and we want to be able to leverage such innovations in a better way to improve equity and access to digital solutions. So this coalition building or partnership building we see as being one key accelerating innovation in public health and in addressing equity in access to health services. So that's really the main areas where we're looking to invest, and we're certain that it's going to, by working with the different health authorities across the region, it's really going to have a positive effect in accelerating the application of digital health for all in the European region.
Mm-hmm. Thank you. Mr. Clayton, so time is changing, and last year you visited Kazakhstan, Nur-Sultan, you was at exhibition Digital Health, and nowadays we are talking like this. Thank you for your time. And one more question, how is the situation in your country now?
Well, at this point in time, and I'm specifically, the regional office is located in Denmark, I think we're seeing a similar pattern to what we're seeing in many European countries, and that is we're seeing a so-called second wave begin to rise. And we're seeing different governments apply different methods in order to mitigate that particular surge without having a very hard lockdown approach. And of course, this means that, and I think it's fair to say also, the public has become much more aware and much more educated as to the possibilities which exist to mitigate this rise. So there are specific approaches which are being taken in schools and other areas. We're seeing the specific measures being applied in certain restaurants and bars such that they close earlier. And really, we're seeing actually the numbers now begin to slowly decrease as these particular public health interventions start to take effect. So again, I think the ability of hospitals to cope with the surges that we've seen and the ability of the public to respond effectively to the messages which are being given by health authorities has improved to the extent that we're able to better manage the pandemic at this particular point in time. Of course, what we're all hoping for is that in the near future, a reliable vaccine is produced, that we can then further mitigate the rise of COVID-19 and also resume a more normal lifestyle, as we all hope that we can do so.
Yeah, hope. So we just want to say thank you for your time, for this information that you said.
Thank you very much. It's been a pleasure.
Thank you. the speaker of our exhibition conference, Mr. Clayton Hamilton. Dear members and participants of the International Interactive Conference, we will see you on the next session. See you. Bye-bye.